Turning now to a promising way to treat depression. A new study shows that ketamine helped reduce anxiety and suicidal thoughts. For more on this treatment is Dr. Christina Inglesia, a psychologist in Walnut Creek. Christina, nice to see you. People might not be familiar with ketamine, so first explain what it is and how it's being treated for those suffering from depression.
So ketamine first came onto the market in the 1960s as an emergency medicine drug used in the Vietnam War. Fast forward, it began its use as an anesthetic in hospital settings and emergency room departments. What we began to see throughout these original uses of ketamine was that there was a mood altering impact that then in 2020 became much more visible with the FDA approving certain types of ketamine treatment for treatment-resistant depression and anxiety. What we are now seeing in the most recent study published just yesterday from the Journal of Clinical Psychiatry is that now there has been enough evidence through patients who have utilized ketamine that we are seeing significant improvements in suicidal ideation, depressive symptoms, self-harm, and other severely limiting mental health challenges.
Okay, so let's talk a little bit more about this study. It was lengthy, more than 3 years, and followed 424 people who were treated at ketamine infusion clinics in Virginia. And the study shows what you just talked about. Patients saw a significant reduction in symptoms of depression. This was after 10 infusions. Researchers say 72% of patients saw improvement in their mood and 38% were symptom-free. I mean, how much hope does this drug hold for all of us?
Again, like every medication, we're always weighing the benefits and risk. But what the data has illustrated to us very clearly is that there were significant improvements for the patients who they studied throughout these 3 years. Having that much symptom relief is absolutely something we want to further explore with additional clinical research trials and studies so that we can get a better understanding of both the benefits, but also any potential risks that we might find later down the road, as this is still a relatively new medication that we are trialing out for the public.
That's what I was going to ask you about. Do we know about any adverse effects at this stage?
Right now, we do know that people have different reactions when they are getting these infusions. Anything from nausea to blurry vision to attention and judgment issues. But what we are seeing is that once the infusion has been completed, people are able to go home, and that is when they are reporting these benefits of having less severe mental health symptoms. So what we want to look at is these longer term studies are where are these patients in 3, 4, 5 years, and are we seeing any adverse impacts that we need to be aware of throughout the body using this medication for mental health struggles.
And my final question to you, though, obviously you treat people who are suffering from depression, anxiety, having these suicidal thoughts. I mean, how hopeful are you in terms of this study's findings?
We are in a mental health crisis. We have been for many years, and the pandemic only heightened that. So when I'm thinking about the people that I serve and support, I want to have as many options in my toolbox to be able to offer them in case one of their treatments are not effective. Then I have a plan B, C, D, E. So yes, it is important anytime we're seeing breakthroughs, whether it's in medication, whether it's in alternative treatments, that we can offer the people we serve so that hope is always on the table, treatment is always on the table. So I take this as a positive step forward in being able to offer people numerous options to find relief and wellness in their life.
All right, Walnut Creek psychologist Dr. Christina Inglesia, thank you again for your time.
Of course, thank you for having me.